Hi there, I'm Dr. Marlene East and I'm a licensed mental health counselor from Panama City Beach, Florida. I completed an education doctorate in 2015 in curriculum and instruction with a specialization in instructional technology. I'm excited to share my dissertation research about mental health mobile applications in counselor education. In this video, I will explain relevant ethics codes, the theoretical foundation, and my research design. About 4 years ago, when I began to notice mental health-related apps in the iTunes App Store, my curiosity was piqued. I was intrigued with the potential of a ubiquitous tool with such potential for learning. I wondered how I could use apps to enhance treatment in my counseling practice. I wondered about the noticeable lack of training regarding these apps. I thought about privacy and information security issues. I also wondered how I could be a part of creating apps to improve access to mental health services and help clients reach their treatment goals. My desire to learn more about the use of mobile applications in mental health inspired me to obtain a doctorate degree. My dissertation research was an effort to blend counseling, education, and technology. As I began to search the literature, I found indications regarding the potential of mental health mobile apps to change the face of psychological assessment and intervention, and realized this leads to the need for effective education regarding these innovations and the need to determine the factors that influence counselor educators' decisions regarding including or not including mental health mobile apps in instruction. The literature review also indicated an absence of research regarding mental health apps in counselor education. For my research questions, I investigated what factors influence counselor educators' values of mental health apps as therapeutic tools, and what factors influence counselor educators' intentions to teach students about mental health mobile apps. I also investigated how and to what extent our graduate training programs are contributing to the technological competence of future counselors, particularly regarding training them to evaluate and integrate mental health mobile apps. So what is a mental health mobile app? Mental health mobile apps are assessment, education, and treatment interventions accessed via mobile phones. If you search in the app stores for topics such as anxiety, bipolar disorder, depression, mindfulness, OCD, phobias, PTSD, substance abuse, stress management, and suicide, you will discover thousands of apps. Prices range from free to $90. Mental health mobile apps are included in the 2015 term MH squared. Clough and Casey define MH squared as any psychological or mental health intervention that is delivered or supported by the use of technology. With thousands of mental health apps readily available, how do we determine which apps are reputable, safe, and beneficial? Of course, the first place we turn to as mental health professionals are the ethics codes of our associations, such as the American Counseling Association, American Psychological Association, the Association for Addiction Professionals, and National Association of Social Workers. Overall, our ethics codes direct us to do what is good for clients, to do no harm, and to promote the dignity and worth of individuals. Most of the ethical codes have been revised to include guidance for technology integration. The ACA code directs counselors to actively understand how to use technology resources to better serve clients. Addiction professionals are to continually seek out new and effective approaches to enhance their professional abilities. Actively understand and continually seek out are action phrases. We are to actively pursue understanding of how to integrate behavioral health technology research and refrain from practicing in only the same ways we were taught in our college training. The Council for Accreditation of Counseling and Related Educational Programs, CACREP, the main accrediting organization for graduate-level counseling programs, has several technology-related education program requirements. Counselor education programs are to produce evidence of the use and infusion of technology in program delivery and technology's impact on the counseling profession. They are to provide instruction based on the most current knowledge, and they are to provide instruction based on an empirically based techniques, procedures, and modalities. Counseling faculty must be diligent about adapting curricula to include research-based efficacy evidence regarding mobile mental health applications. Let's also think about ethical codes regarding professional development. Continuing education is to reflect current knowledge and emerging developments, and counselors are to be open to and obtain training on new procedures. In my literature review, I found several studies regarding efficacy and efficacy potential of various apps. If you'd like to read these studies, you may access my dissertation and reference list through ResearchGate, Google Scholar, or through your library's ProQuest dissertation and theses database. The research is rapidly increasing, especially with the growth of journals devoted to electronic health and mobile health subjects, such as Journal of Medical Internet Research, Journal of Mental Health. With the existence of efficacy studies and efficacy potential studies comes an ethical responsibility to understand and integrate mental health mobile apps into counselor education and practice. In creating new knowledge, it is useful to look outside our main field of expertise. We know that looking at something from multiple angles is called triangulation, and I applied technology use and acceptance and innovation diffusion theory to learn more about mental health app adoption in the counseling field. In the area of technology use and acceptance, much research has been undertaken. Venkatesh Davis and colleagues have continually worked to study and refine our understanding of the factors that contribute to our behavioral intention or conscious plans to use a technology. This 2012 diagram of unified theory of acceptance and use of technology is the most recent model. The terms on the left are the independent variables, the terms on the bottom are covariates or modifiers, and the terms on the right are dependent variables. The variables on the left are direct influencers of intention to use a technology and of actual use behavior. Notice the variable on the top left, performance expectancy. What will I get out of using this app? What's in it for me? Over time, performance expectancy has been found in research to be the strongest predictor of behavioral intention to use a technology. One of our sons works for a software company in Ukraine and also has a business designing explainer videos. He and I were talking last year about app development, and he said he has learned that in the first few minutes of using an innovation, a user must see some real benefit for themselves or they will not use it. Now let's talk about effort expectancy. How much time will this take? How difficult will it be to use this technology? And then social influence. Are other people who are similar to me using this technology? Facilitating conditions. Do I have all the devices, cords, Wi-Fi, tech support, and the ability to pay my phone bill? The three variables at the bottom left were added in the 2012 model. Hedonic motivation, which can be enjoyment from using apps, price value, apps in general are affordable, and habit, whereby our daily use of apps sets the stage for us to use health and mental health apps. You will notice that some of the variables on the left are modified by age, gender, and level of experience. Another theoretical foundation I used for my dissertation study was innovation diffusion theory by Rogers. This theory is included in the unified theory. However, when we are concerned about why a profession like ours is lagging behind in technology use and acceptance, it is important to look more specifically at the social influence piece and study how an innovation diffuses throughout a social system. Here are attributes Rogers identified that feed into the decision to adopt an innovation across a social system. Advantage over prior ideas. Can using a therapy app on a mobile phone have advantage over books or paper and pencil homework? Yes, I think so. How compatible is the innovation with needs of potential adopters? As a profession, perhaps our mentality has been, we're doing just fine and we don't need all this technology. Perhaps with training lagging way behind innovations, we've not been able to critically think about technologies that are indeed compatible with therapy. Complexity of use is akin to the effort expectancy we saw in the unified theory of technology use and acceptance. Trialability. This is the degree to which an innovation may be experimented with on a limited basis and offers the opportunity to learn by doing. I tested the impact impact of trialability in this study. Observability of outcomes is another attribute of our decision to adopt an innovation. To what degree is the innovation effective? Are efficacy studies available? How easy is it to access and understand those studies? Now let's address research design. For this study, I used a sequential, explanatory, mixed methods approach. First, I collected quantitative data from counselor educators and analyzed it using SPSS. Then I interviewed 10 educators and analyzed that qualitative data within Vivo software. Lastly, I evaluated the relationships between the two phases. In the first phase, counselor educators completed a 4-part questionnaire. Section 1 collected general demographic information, level of app experience, and training about mental health apps. Section 2 was divided into sections based on the unified theory and collected data about views about mental health apps. In Section 3, educators downloaded and interacted with an app. They used this section of the questionnaire to critically think about and evaluate that app. I chose the PE coach for prolonged exposure therapy as it had efficacy studies and was developed by a reputable government organization. In Section 4, educators again completed Section 2. This helped me measure the impact of trialability on attitudes towards mental health apps after interacting with a reputable app. Let's summarize. In this video, you've learned what sparked my interest in the topic of mental health apps, why we need to be familiar with and integrate mental health apps according to ethics codes. You also learned about my dissertation, Theoretical Foundation of Technology Use and Acceptance Theory and Innovation Diffusion Theory, and you developed an understanding of the mixed methods research design. The remainder of the presentation will address participants' findings and implications for counselor education. Thanks for watching.